Welcome to the COVID-19 Paris Union High School District Training. Agenda: train in the following safety actions: how COVID-19 spreads, COVID-19 specific signs and symptom identification, screening practices, physical distancing guidelines and their importance, enhanced sanitation practices, prevent the spread of COVID-19 if you are sick, COVID-19 specific symptom identification and when to seek medical attention, the workplace plan to follow when individuals become ill, and protecting other employees, provide information to all staff and families on proper use, removal, and washing of cloth face coverings, and district-specific policy. How COVID-19 spreads. COVID-19 is spread mainly through person-to-person contact between people who are in close contact with one another within or less than 6 feet, through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. People touch contaminated surfaces and then people touch their face, nose, eyes, and/or mouth. COVID-19 may be spread by people who are not showing symptoms. Facts about COVID-19. COVID-19 is an infectious disease that can spread through the air. Particles containing the virus can travel more than 6 feet, especially indoors, so physical distancing must be combined with other controls, including face coverings and hand hygiene, to be effective. Identifying COVID-19 signs and symptoms. Some of the most common COVID-19 signs and symptoms: fever greater or equal to 100.4 Fahrenheit, difficulty breathing, unexplained sore throat, unexplained headache, cough, unexplained congestion, unexplained runny nose, new loss of taste or smell, shortness of breath, unexplained fatigue, unexplained muscle or body aches, and unexplained nausea, vomiting, or diarrhea. COVID-19 signs and symptoms. Signs and symptoms may appear 2 to 14 days after exposure to the virus. Anyone can have mild to severe symptoms. In some cases, there are people that have had no symptoms but had COVID-19. This is referred to as an asymptomatic case. Individuals with underlying health conditions are considered at higher risk for developing more serious complications from COVID-19 illness. These conditions include, but are not limited to, serious heart conditions such as heart failure, coronary artery disease or cardiomyopathies, chronic kidney disease, obesity, sickle cell disease, solid organ transplant, type 2 diabetes. Health conditions also currently under investigation as comorbidities related to poor COVID-19 outcomes include chronic lung disease, asthma, metabolic disorders, including type 1 diabetes, immune deficiencies, liver disease, and neurological conditions. Seek emergency medical care by calling 911 immediately if you or someone you know has trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face, low pulse ox saturation reading less than 95%, unless the individual has an underlying health condition and typically has low O2 saturation readings. Pulse ox in relation to students is only to be used with the direction of credentialed school nurse or by licensed personnel. Anyone can call 911. When using district phones, dial 911 or 0 for the operator to call 911 for you. When you are calling with a cell phone, it is important to note that California Highway Patrol dispatch will handle the call. Therefore, it is imperative you know the address of the location in which you are at. When dialing 911 from district phones, it will automatically generate an email to the district and site administrators. Once 911 is called, be prepared to provide site's address, Have a designated person meet the ambulance, open gates, and guide emergency personnel to the location of the emergency. Inform the front office and administrators that 911 was called, especially if 911 was called with a cellular versus district phone. Emergency action plans are posted by each automated external defibrillator on sites and need to be considered anytime 911 is called. COVID-19 screening practices. Self-screening for COVID-19 is an effective way to prevent the spread of COVID-19. Employees must complete daily self-screening for COVID-19 signs and symptoms before coming to work. Employees must complete the daily COVID-19 attestation monitoring protocol prior to entering a district facility. COVID-19 self-screening practices continued. Do not come to work. Call HR if you have signs and symptoms of COVID-19, been in close contact that is less than 6 feet for a cumulative of 15 minutes with someone that is COVID-19 positive, or has been told by a healthcare provider to get tested for COVID-19, are feeling ill, and or have tested positive for COVID-19 within the last 10 days. Do not come to work and call HR. Temperature guidelines. When taken via oral or tympanic, a fever is considered a fever of 100.4 degrees Fahrenheit or greater. This method is acceptable for the home setting. When using a non-touch thermometer, a fever is considered a fever at 100 degrees Fahrenheit or greater. This is the only acceptable method that should be used in a workplace setting. Ways to protect yourself and physical distancing guidelines. Stop COVID-19 from spreading. The best ways to stop COVID-19 from spreading are to wash your hands for 20 seconds or use fragrance-free 60% ethanol hand sanitizer until it is dry on your hands. Physical distance from others, at least 6 feet or greater. Wear face coverings. Stay home if you are ill. When to wash your hands. Before preparing food and during food preparation, eating, touching your face, using the restroom, putting on your face covering, treating a wound, changing diapers or caring for someone else. After preparing food, blowing your nose, coughing or sneezing, touching your face, using the restroom, removing your face covering, treating a wound, changing diapers or caring for someone else, touching an animal, animal feed, or animal waste, touching garbage, being in a public area, or coming home from school. How to wash your hands. With soap and water, following these 5 steps every time. Wet your hands with clean running water, warm or cold. Turn off the tap and apply soap. Lather your hands by rubbing them together with soap. Lather the back of your hands, between your fingers and under your nails. Scrub your hands for at least 20 seconds. Need a timer? Hum the happy birthday song from beginning to end twice. Rinse your hands well under clean running water. Dry your hands using a clean towel or air dry them. How to sanitize your hands. With fragrance-free 60% alcohol hand sanitizer, follow these steps every time. Apply the gel product to the palm of one hand. Read the label to learn the correct amount. Rub your hands together. Rub the gel over all the surfaces of your hands and fingers until your hands are dry. This should take around 20 seconds. Contact your designated COVID administrator at your site for hand sanitizer. If the sanitizer is consumed, call Poison Control at the number provided. Key notes to hand sanitizer. Hand sanitizer should be used only when employees do not have immediate access to a sink or hand washing facility. If hands are soiled, hand washing is recommended. Physical distancing. Use the term physical distancing versus social distancing. Practice physical distancing by staying 6 feet apart, 2 arms length from others. Arrange classroom to promote physical distancing. Stagger student seating. Arrange staggered arrival and departure times. Designate entry and exit points. Minimize crowding and lingering. Keep door or windows open to promote ventilation. Physical distancing continued. Work with your designated COVID administrator for barriers, signs, stickers to help remind about proper 6 feet social distancing. Here's a helpful flyer to help remind you of how you can help slow the spread of COVID-19. Wash your hands often, at a minimum of 20 seconds. When out with your friends, wear a mask and stay 6 feet apart from others. Clean frequently touched objects. Cover your coughs and sneezes. Do not touch your eyes, nose, and mouth. Stay home if you are sick. Stay home when ill. If you have signs and symptoms of COVID-19, been in close contact that is less than 6 feet for a cumulative of 15 minutes or more in a 24-hour period with someone that is COVID-19 positive or has been told by a healthcare provider to get tested for COVID-19, are feeling ill and or have tested positive for COVID-19 within the last 14 days. You may be asked to self-quarantine or isolate. Employees should notify HR, and students should notify the health office. Clean and disinfect. Where you should clean. Clean high-touch surfaces daily or as needed, such as desks, door handles, keyboards, faucets, tablets, bathroom surfaces, light switches, doors, toilets, sinks, the computer mouse, tables, phone, countertops, handles, chairs. Disinfecting. Use district-provided spray and wipes. Follow the manufacturer's guidelines. Cleaning and disinfecting of all classrooms will occur daily. The district will assign personnel and establish routine schedules to clean and disinfect common surfaces and objects in the workplace. Disinfecting continued. The process of disinfecting includes providing disinfecting products that are EPA approved for use against the virus that causes COVID-19. The district has made disinfectant and disposable towels available to any employee who chooses to use on a voluntary basis in between established cleaning disinfecting schedules. The disinfectant does not require personal protective equipment for use. Before using disinfectant, staff have to complete the integrated pest management training in Keenan. The district does have Clorox wipes for SPED and high-risk rooms and/or areas. Please note that students are able to use Clorox wipes, however, they are not allowed to use disinfectants because they are considered a pesticide. Limit the spread. Limit sharing of supplies. Limit water fountain use and/or sharing. Bring your own water container. Health office can use disposable cups. Identify activities that have less contact with high-touch surfaces. Clean your workspace, classrooms, health office, etc. daily. When choosing disinfecting products, use those approved for use against COVID-19 on the Environmental Protection Agency approved List N and follow the product instructions. If you will be using Clorox, Lysol, or other disinfectant wipes, make sure to complete the IPM training on Keenan. To reduce the risk of asthma and other health effects related to disinfecting, programs should select disinfectant products on the List N with asthma-safer ingredients, as recommended by the U.S. EPA Design for Environment program. Face coverings. Face coverings. Employees, visitors, and students must wear a face covering whenever indoors and outdoors, across all district sites and during all school-sponsored activities. Clean and undamaged face coverings, face masks, are available for staff. Staff can provide their own facial coverings as long as it is worn properly and covers both their mouth and nose. Face covering for students. Students must wear a cloth or disposable face covering at all times when in the presence of others while on district property. According to the guidelines provided by CDPH, students excluded from this requirement are those who have medical exemption, including those who require respiratory protection or are unable to wear face coverings due to the nature of their disability. Face coverings for students and staff. The district will provide face coverings to all students and staff if they do not have their own, or if their face coverings are in need of replacement. Face coverings are not respiratory protective equipment. Face coverings are intended to primarily protect other individuals from the wear of the face covering. Face coverings are a tightly woven fabric or non-woven material with no visible holes or openings, which covers the mouth and nose. All adult staff must adhere to the district's face covering and social distancing policy at all times. The California Department of Public Health face covering exemptions. Face coverings must be used in accordance with the CDPH guidelines unless a person is under age 2, has trouble breathing due to underlying health conditions, is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. Given this recommendation, the use of personal protective equipment, PPE, can only be effective for students able to understand and comply with directions for proper use. Some students with sensitivity to touch, smell, or pressure may not tolerate facial coverings. Adapted face coverings for teachers and staff, such as face shields with drapes to allow for visualization of lip reading and facial expressions, may be useful for some students. Ask COVID administrator at site to obtain adapted face coverings. Here is a quick video link for proper use and removal and washing of your cloth face coverings. Proper use, removal, and washing of cloth face coverings continued. How to wear your face covering correctly. You should first wash your hands, pick up the face covering by the head or ear strings, loop the strings over the top of your head or around your ears, put it over your nose and mouth and secure it under your chin. Try to fit it snugly against the sides of your face. Make sure you can breathe easily and wash your hands after. How to remove your face covering correctly. Wash your hands, untie the strings behind your head or stretch the ear loops, handle only by the ear loops or ties, fold outside corners together. Be careful not to touch your eyes, nose, and mouth when removing. If you need to reapply your face mask, set it on a clean paper towel or paper bag, and then wash your hands immediately after removing. To wash your face covering correctly, your cloth face coverings should be washed after each use. You can include your face covering with your regular laundry. Use regular laundry detergent and the warmest appropriate water setting for the cloth used to make the face covering. How to dry your face covering correctly. You can dry it in the dryer. Use the highest heat setting and leave it in the dryer until completely dry. You can also air dry it. Lay flat and allow it to completely dry. If possible, place the cloth face covering in direct sunlight. Face shields. Face shields combined with a mask are recommended for staff when a student cannot wear a facial covering and cannot control secretions, including sneezes, coughs, forced expiration of breath, or spitting. To fit properly, a face shield should extend below the chin anteriorly to the ears laterally, and there should be no gap between the forehead and the device frame. Face shields can be cleaned, are capable of reuse after disinfection. Face shields effectively block droplets when combined with recommended social distancing, while allowing others to see facial expression and lip movement. CDC does not recommend use of face shields for normal everyday activities or as a substitute for cloth face coverings. Paris employees will not be approved to wear only face shields unless it is a face shield with drapes and only in very limited instances. Personal protective equipment, also known as PPE. PPE includes surgical mask, N95 respirator, eye protection, disposable gloves, booties and/or shoe coverings, and/or a gown, disposable or cloth. Cloth face coverings are not considered PPE. Generally, PPE is worn for a specific support service. PPE continued. The district will evaluate the need for PPE and provide such PPE as needed persistent to CCR Title 8, Section 3380. The district will evaluate the need for respiratory protection in accordance with CCR Title 8, Section 5144 when physical distancing requirements are not feasible or maintained. Any PPE used by employees shall not be shared. PPE continued. PPE will be provided by site administration upon request. Gloves, face shields, shoe coverings, and gowns will be provided to staff as needed. Specs, toileting, diapering. Specialized physical health care services requires training by district nurse. Examples would be G-tube feeding, catheterizations, etc. Toileting and/or diapering does not require training. It is recommended that the PPE used is gloves, face shields, and gown. The CDPH has not provided specific guidance related to specs, toileting, diapering. Additional guidance is forthcoming. Additional infection control measures. Staff must clean hands using soap and water immediately after touching blood, bodily fluids, non-intact skin, mucous membranes, or contaminated items, even if gloves were worn. Immediately before eating, after using the restroom, and after coughing or sneezing into a tissue, and when hands are visibly soiled. Paris Union High School District Specific Policy. District Strategies Administrative Controls. The district has implemented a daily COVID-19 attestation monitoring protocol that includes a reporting process for employees to complete prior to entering a district facility. There will also be visitor screening protocol applying to each district location. District Employee Responsibility. An employee should stay home if they are sick, follow public health agency guidelines, and contact their administrator or supervisor. District Strategies Administrative Controls. If an employee is showing symptoms related to COVID-19 while at work, the supervisor or administrator should immediately contact HR. If an employee is experiencing medical distress, call 911. District Employee Responsibility. All district employees should report COVID-19 symptoms and possible exposures to human resources. All district employees and their authorized employee representatives are encouraged to report COVID-19 hazards and mitigation practices in the workplace to their supervisors, administrators, human resources, and/or risk management. District Employee Responsibility. Employees can report symptoms and hazard without fear of reprisal. Employees must contact human resources if they require accommodation with medical or other conditions that put them at increased risk of severe COVID-19 illness. Passive versus active screening. Passive screening is a self-assessment of symptoms, visual wellness check as students and staff enter campus. Active screening is verbal, visual, and physical assessment. COVID-19 staff testing. Risk management will also provide COVID-19 testing for staff when an outbreak within a Paris Union High School District workplace has occurred, in accordance with Cal OSHA Regulations AB 685. Testing will be provided to employees directly involved in the specialized cohort, in accordance with Governor Newsom's Safe Schools for All plan. Risk management will also help facilitate COVID-19 testing for staff when in-person instruction begins. Exclusion of COVID-19 cases. Employees will maintain earnings, seniority, and all other employee rights and benefits if excluded by human resources due to COVID-19. Employees who have any other issues related to COVID-19 must immediately contact human resources to discuss possible accommodations or leave options. Return to work criteria following COVID-19. Confirmed COVID-19 cases shall not return until cleared by Human Resources. To be cleared, the employee must meet the following criteria. At least 24 hours have passed since a fever of 100.4 Fahrenheit or higher has resolved without the use of fever-reducing medication, and COVID-19 symptoms have significantly improved, and 10 days after your symptoms began or 10 days after a positive COVID-19 test. Testing students. Risk management will coordinate testing for students in conjunction with district nurses and health staff. Testing will commence when in-person instruction begins, including in-person specialized cohorts as noted by Governor Newsom's Safe Schools for All plan. Testing will be conducted consistent with the requirements of the California Department of Public Health and in testing cadences based upon the tier assignment for Riverside County. Student procedures. Parent and/or guardians must ensure student is completing a daily passive self-check prior to sending a student to school. Students must wear a cloth or disposable face covering at all times while on district sites. According to the guidelines provided by CDPH, students excluded from this requirement are those who have a medical exemption, including those who require respiratory protection or are unable to wear a face mask due to the nature of their disability. Students will have their temperature checked at the gate prior to entering campus by designated staff. Note, the parents and/or guardians may not leave students prior to the temperature check clearance. Student procedures continued. Any student who demonstrates or complains of any COVID-19 related symptoms, the staff will direct students to the transition area. Parents will be notified and provided with written and/or electronic documentation of their student symptoms and return to school timelines. Sick or ill students cannot remain on campus. Students must be picked up within 30 minutes if they are ill and/or have symptoms of COVID-19. Student-only transition area. It is not to be referred to as the isolation area. This will help in the reduction of stigma. This area will have confidentiality. It will be a holding area for students waiting to be picked up with symptoms consistent with COVID-19. Supplies in this area will have hand sanitizer, gloves, masks, eye covering, vomit bags, disposable gowns, shoe coverings, reusable gowns, trash bags, thermometers, blood pressure cuff, stethoscopes, pulse ox, water bottles, disposable cups, procedure tray covers, tissues, and paper towels. Identification and reporting of cases. COVID-19 case reporting will be provided to Riverside County Department of Public Health for any student or employee who was present at a school site or any district location within the 10 days preceding a positive test for COVID-19. Communication plan. Communication will take place with students, staff, and parents about cases and exposures at school sites and any district locations in accordance with the requirements provided by California Department of Public Health and the Riverside County Department of Public Health. Thank you all for your participation and all the hard work you do for our district.